When it comes to economic indicators, Ohio continues to do well, climbing to the top of the national rankings. Unfortunately, the same cannot be said about another very important issue, that of infant mortality, where Ohio continues to lag the rest of the nation. State Senator Shannon Jones has introduced some legislation to reduce infant death in Ohio, and she joins us today in our caucus conversation. Senator, thank you so much for joining us today.
Glad to be here.
These numbers are frankly just awful. 48th in the nation overall for infant mortality rate, 49th among African Americans. What can we do?
Well, it is shocking indeed. I mean, the truth of the matter is over 1,000 babies die every year in the state of Ohio, many of them preventable. So we need to do more to try to lower those numbers. And it's a complicated problem. You know, there's not a single answer, but I don't think those numbers really reflect the spirit of Ohio. This isn't who Ohio is, so we have to continue to be vigilant. A couple of key issues. Safe sleep is a really important one. We know that SIDS-related deaths account for 15% of the infant mortality in this state. So more education, more discussing about safe sleep practices are necessary so parents know what to do to keep their children safe.
You've been working on this issue for quite some time. This past summer, you went around the state really talking with medical experts and other folks about this issue. Talk about what you heard.
Sure. Well, we did take the Senate Health and Human Services Committee on a tour. We went to 6 different cities around the state. And, you know, what we heard is both encouraging as well as discouraging. So a lot of really good programs happening in the communities. But what we learned is that it's a multifaceted problem. It's not just a healthcare problem. It's also a social and economic problem. And so the good news is there's a lot of evidence-based practices out there that we have great data on, amazing people not only doing the research, but actually the interventions where we're seeing real results. The tougher news is that it's going to take some time for us to figure out how do we get this evidence and these best practices to a scale where we can start moving Ohio's numbers.
Now, this is a bipartisan effort. You, this past week, held a press conference with Senator Shalita Tavares to talk a little bit about what you're going to be trying to do here moving forward. You mentioned Senate bill, this is going to be broken up, I guess I should say, into 5 separate bills. You mentioned the safe sleep education, that's Senate Bill 276. Senate Bill 277, the Infant Mortality Commission. Can you talk a little bit about that? You
know, whenever you have a problem as big as this one, I think that we need to make a statement from the state's perspective that we're serious about it. And so this is a commission that's bringing forward the heads of all of the major departments as well as people who are working in the field to come together, start inventorying not just the state programs, but the local programs and possible revenue streams, and looking for those opportunities to make recommendations not only to the legislature and to the governor, but also back to those local communities as we're trying to make those best practices a reality.
Senate Bill 278, Understanding SIDS, Senate Bill 279, the Health Center Pilot Project, and then this last one, Senate Bill 280, the postpartum care and then reimbursement for non-medical services. Talk about the importance of, you've talked a little bit about education, but how important it is to spend that time post birth with the birth mom.
Yeah, I mean this is one of the tricky issues because what we know, first of all, is that a lot of one of the leading drivers of infant mortality is prematurity. A lot of that can be alleviated if moms are getting in and getting health care early in their pregnancies, even before they get pregnant, quite frankly. Things like taking their vitamins and getting their prenatal checks and high-risk moms can have some extra interventions to have healthy babies. But historically, what's happened is once those moms have had their babies, while the baby may continue to get well baby checks, those moms kind of fall off the radar screen. And so this is really instructing our managed care programs and insisting that they do care management with these moms, because what we know is having proper birth spacing, being between 18 and 24 months between pregnancies, is critical for women having healthy babies at a healthy weight. You do those things that you incent to do. And so this is a way for us to incent properly looking at the issue, managing the issue, and the managed care programs getting paid for taking care of these patients.
Well, this is a big family issue that you're working on. Another one that you've been involved in is adoption reform. Tell us what your plans are there.
Adoption has always been something that I've done a lot of work on, care a lot about. So there's the bill that we've introduced is one, and that's with a colleague, Senator Frank LaRose, is my co-sponsor on that bill. And I think the cornerstone of that is an adoption tax credit. And what's really exciting about how this has been structured is not only is it raising an existing tax credit from $1,500 to $10,000 for families who adopt, but it's making it a refundable credit, meaning that even if the tax liability isn't the full $10,000, that families, particularly lower and middle income families, especially those who adopt out of the foster care system, will be able to take full advantage of the tax credit. That's really important when you consider that Ohio has over 20,000 kids in the foster care system, and every year we have about 1,000 of those kids that are aging out of the system before they get adopted. And so this is a really smart way for us to say, okay, we know taking care of a child in foster care in the state of Ohio costs us about $24,000 a year. With a $10,000 credit to help these families make ends meet for all of the costs associated with taking on children in your home, it's a bargain for taxpayers, and it's wonderful for families and kids.
Let's talk about another tax issue. One of the things that we've talked a lot about when we talk with members are about some of our larger priorities, which are the job growth and economic development. A big part of that is education. Mm-hmm. And it's not just K-12, but it's all the way through. And we've talked a lot about, again, those workforce development programs where you're talking about 2 years and 4 years and how we're going to get more people trained for the jobs of tomorrow. You have a bill that would allow an increase in the tax deduction for college savings plans. Talk a little bit about that.
Well, I'm really excited to have a new bill with Senator Gardner rehashing a proposal that I put forward early last year to try to get an increase in the deduction. Currently, Ohio law allows families or individuals to save $2,000 a year with that tax deduction. What we're proposing is increasing that to $10,000 a year so that families can make investments in their children's or their own education, take advantage of that. And in doing so, it also addresses a problem, not only wanting to encourage kids to go to higher education, but we know in this state, a lot of kids are coming out of college with huge amounts of debt. And so this is a very family-friendly way for us to provide some tax relief for families while they're saving for this expensive endeavor for their families.
So these are some really important issues, and thank you so much for the time that you spent talking with us about it today.
Thanks for having me.
And thank you for joining us. As always, you can keep up to date with us every day on our social media pages, Facebook, Twitter, Instagram, YouTube, at Ohio Senate GOP, or visit our website, ohiosenate.gov/Republicans. Thanks for watching.